hearing a while back about a little boy that had a cancerous growth on one of his organs and ended up having to have surgical treatment to get it removed. And his parents were told that there was a possibility that there would be a little bit of blood loss and he'd have to have a blood transfusion. Now, I don't know if all of you are parents, but that's a little scary. And if I were in that situation, I'd want to know more about blood donation and what a transfusion is and what that entails of. And I couldn't imagine being that parent and having to know that there is actually a shortage in blood donations around. So you're going to think, is he going to be okay if there's not enough? What's going to happen after that? So donating blood is an amazing way to help one another in a time of need. And in fact, did you know just this past July, 2018, there was 15,000 fewer donations that were needed for life-saving treatments and emergency care. That's why it's critical for people to donate, especially type O negative, which is what they call the universal blood type. And this is also what emergency rooms go to in car accidents. That's the first thing they'll go for, is that blood, because they don't have time to check and make sure what kind of blood type you are. So what is a blood donation? The Relay Health stated that blood donation is the procedure for giving some of your blood to a blood bank. And that blood is available to others who may need it through blood transfusion. And blood transfusion, per the American Cancer Society, explained that blood transfusion and blood products may be given to a person who is bleeding or can't make enough blood cells. And blood transfusions save millions of lives in the United States every year. And this is also some information about blood types of donations that you can give, because it's not just walk in and get blood and it's gone. There's actually more specifics, and this is all for the American Red Cross. There's a whole blood donation, and a whole blood donation is the most flexible type of donation. It can be transferred in its original form and used to help multiple people when separated into specific components of red cells, plasma, and platelets. Whenever I go to my local blood bank, that's what I donate, and it takes about 1 hour, sometimes less if you get somebody who knows what they're doing as far as sticking you and you have good veins. And who that helps, it's frequently given to trauma patients and people undergoing surgery. There's also the Power Red donation. During that, you give a concentrated dose of red cells, and that part of your blood is used every day for the needing of transfusions as part of their care. The type of donation is used to automate a process that just separates your blood cells from the other blood components, then safely and comfortably returns your plasma and platelets to you. And that's a little bit extra time. It's about an hour and a half. And who that helps is typically also given to trauma patients, newborns and emergency transfusions during birth, people with sickle cell anemia, and anyone suffering from blood loss. There's also platelet donation. Platelet donation is tiny cells in your blood that clots and stops bleeding. And they're mostly used by cancer patients and others facing life-threatening illnesses and injuries, like people with kidney disease. In platelet donation, the Aphrus machine collects your platelets along with some plasma, returning your blood cells, or your red cells, and most of the plasma back to you. In a single donation, the platelets can yield several transfusible units, whereas it takes about 5 whole blood donations to make up a single transfusible unit of platelets. And that takes a little bit more time, so you probably want to set aside about 2.5 to 3 hours. And who that helps are cancer treatment patients, organ transplant procedures, as well as other surgical procedures. Plasma donation. During an AB Elite donation, you can give plasma, a part of your blood used to treat patients in emergency situations. And it can also be given to anyone regardless of their blood type. It's a collection through an automated process that separates the plasma from other blood components and safely and comfortably returns it back to your blood cells and platelets to you. And it maximizes your donation and takes just a few minutes longer than donating blood. So it's about an hour, 15 minutes. And that helps anyone in emergency and trauma situations and helps stop the bleeding, so it helps a clot. And like I said before, all these people that need this are going to be your cancer patients, your trauma patients, sickle cell patients, burn patients, and patients with chronic diseases. So who can donate? Per the American Red Cross, approximately 38% of Americans are eligible to donate at any given time, but only about 10% do that. General guidelines for blood donation. Your donors must have proof of age, so they need 2 forms of ID, so they make sure that you're giving blood from you and not someone else. I don't think that happens, but if it does, okay. I don't know why anybody would give someone else's ID. The other part, they need to be 17 or in some states 16 years of age with parental consent, weighing at least 110 pounds, and they have not donated blood in the last 56 days. And in the process, it's pretty easy. You're going to go in and you're going to get registered. They're going to ask you for your basic information, like your name, address, so forth, some health history, and make sure you're not on any medications that they don't want you to donate with. There's also, if you're sick, feeling a little ill, they don't want that either. And during your donation, they'll cleanse your area and make sure everything's clean. They're going to stick you with a needle, obviously, to get the blood out, and it's not as painful as people may think. Needles are scary to a lot of people, and that's actually another reason why people don't want to donate. And really, if you just think about it, it's only a few seconds that you go through pain, but your pain for those few seconds could save some, possibly in one unit, 5 people or 5 children. Like I said before, it can take like up to an hour, 30 minutes, depending on who you go to. After your donation, they're very kind. They give you some treats and a drink, and after that, you may want to thank yourself because you just saved somebody's life, and potentially more than just one. So we went over all the blood type donations you can give and who can give it. I really hope that you consider donating blood because you never know whenever your neighbor, your friend, or family could be needing it and you didn't realize that you were an acceptable donor to them. I'm going to give you out a couple of handouts from our Central Illinois Blood Community Blood Center. They were generous and gave us a little bit of information about our blood types and the areas that blood is given and where it's used. And just a little FYI, our next blood donation here at Lincoln Land is January 24th. So I hope you all decide to go to it, and you also get a free t-shirt. So